of quiet time together and acknowledge the fact that we are still here and that there have been many challenges in our lives, and we have lost family and friends and important people over the last number of while. And so in your own way, for whomever you want to think of, acknowledge, pray for, do a silent chat for, can we please take just a 2-minute moments of silence to acknowledge the change in all of our lives. All right, thank you, everyone. It's nice to connect and have just a little bit of quiet space, prayerful space, contemplative space with all of you all. So here we are at the moving towards the end of our summer semester. The time has gone, in some ways the time has gone very fast, and in some ways it's been very slowed down. It's such a we're living in such a time of complexity that I can't even begin to speak to all that everyone brings here and the complexities of your lives and what it is that you're juggling. But I do want to thank you for being here today and take some time here to not only just do some reporting back on some of the things that are happening here at our college, but also to there's things that I need for you to know that are going to be coming up in fall semester, and then I want to have questions, time for questions for you all around clinic and what that's going to look like. So things that we need to just acknowledge here, and that is the process around living with COVID-19 has brought about changes for all of us, changes that we could have never imagined, and probably still more changes to come. Our worlds have changed tremendously, and it's just impossible for us to know what lies ahead with those changes. And I know that each and every one of you, students, faculty, staff, everyone has moved somewhere new. How we do our daily lives, how we manage our families, our children, our jobs. Everyone is engaged in new ways of doing things, new ways of managing self, new ways of just somehow keeping ahead of dealing with the mental and emotional and physical challenges that have been presented with this pandemic. And I have to just take a moment to say again that the challenges that you all have met to stay as students, to remain steady with in your course of study and move towards, your graduation. I can't begin to even capture how large some of those changes must be in your lives. And that being said, I know that there are ways that you all have managed those that have not been easy. And knowing that, in Chinese medicine, we talk about change being the very nature of life itself. And knowing that when change comes fast and furious, that it takes an extra amount of balancing to just stay present and thoughtful and not get thrown off balance. And I can only hope that you all are doing everything that you can to take care of yourselves in the midst of so much change being required of you. So much change. And I speak to that for you all as students who are balancing the lives. You may be the fulcrum point of balancing for your children and for your spouses and for your extended families. And so the things that you have been taught, the things that and the use of Chinese medicine, I just simply hope that you are taking advantage of those to take the best of care of yourself. It is so critical at this time. We don't know what's going to happen with this pandemic. We do know that in the Bay Area that we have an increase of of people who are testing positive and an increase of numbers in hospitals. And so our work in this area, how we see our future is still, there's still such uncertainties, and that impacts all of us every day. For you all, looking as students, looking at how you're going to manage not just finishing up this semester, but looking into fall semester and then into spring. I know that there are many decisions that you're having to make, and some of them are not easy ones. And I just want to acknowledge that, those struggles, and as well as for faculty who are balancing their private practices, working part-time, everyone's doing everything they can to live this new way of living with COVID. And the fact that we can come together and just as a group witness each other as people who, kind and gentle people who are, committed to making a difference in the world and helping other people. I bow to you all, and I thank you so much for your commitment to that. So a few more things here. There are things that I want you all to know and be aware of, that in the midst of your daily lives and spending so much time in front of a computer, we all are doing that. And sometimes I feel like it's, the time that we spend in front of computers, does that, what does that do to our awareness and our sensitivities? And how does that help us to engage in deeper relationship with each other? And for you all as students, in relationship to your professors and the assignments and the ongoing work that you're doing. And so in relationship to that, I want you to know that how much I appreciate those of you who have made the time, taken the time to put your concerns and sometimes your complaints and frustrations, but sometimes the suggestions and recommendations of how it is that we can be living this time in a better way, and especially in a better way as an educational institution. And I want you to know that not only do I appreciate that, I really ask that you not stop doing that. Please keep sending those. And I know that some of you have taken the time to do that, and I just read into some of those and I realize that it's a collective message. And I want you to know that those messages, those emails, those concerns, those frustrations, those complaints find their way back to the program committee. And the program committee here at ACTCM meets every week from 1 until 3 o'clock. We've got a 2-hour ongoing standing meeting where we are working with these issues and grappling with them and working to better understand and be in response to you all as students and to the education that we're providing. And just so you know who those people are, that committee is comprised of Jonathan Wheeler, Mark Frost, Valerie Hobbs, Sharon Hennessy, Pamela Olton, Bing Zhou, Jung Kim, Richard Alberta, and myself. And so what you send us, what your concerns are, finds its way to this group. Please know that. And even though we may not be liking everything that we hear from you, if we don't get it, if you don't send that to us, then we don't have that to work with. And I thank you for that. Again, I thank you for making the time to let us know more about what your needs are and what our work needs to be to support you. There's a few things I want to acknowledge as well, and that is recently CIIS sent out a survey, and it was asking for student feedback for online classes. I know that a number of students from ACTCM did provide input into that. For many of us at ACTCM, there were things that we know about, we've been working to improve, but some of that information was new for CIIS leadership, and I'm very grateful for that. I'm grateful to each and every one of you who took the time to respond to that survey. It was a very important piece of work that you did, and it will help all of us in the college. So thanks for that. More will come on that as that information is analyzed through student services, through academic leadership, but I thank you for taking the time to do that. The other update I wanted to speak about today, and that is there are faculty here and students and staff who have really joined in the work around making sure that our college is moving forward as an anti-racist college. And the discussion that has gone on into that in response to things that have happened in our country and in our own communities has given rise to us looking to find folks who we can bring in and provide trainings, not just for us to be in advance our discussion around anti-racism, but to actually serve as trainings for all of us, so that we are engaged in the pursuit of changing our ways and our minds and growing our thinking around how to be in support of individuals and communities that have been hardest hit from not only the pandemic, but ongoing issues around racism. And so students, thank you for that, who engaged in that. And I wanted to ask Megan to share our poster of our most upcoming training with Dr. Tanisha Dandridge. So we have an ongoing series that we've created with Dr. Tanisha Dandridge. A number of you attended this back on, I think it was the 19th of July. We had a good turnout. I'd like to see a better turnout coming out with the next one coming up on August 9th. She's a dynamic teacher and speaker, and she's an acupuncturist, a doctor of acupuncture and Chinese medicine. And so she brings a specific conversation for us to engage in our clinical understanding of how it is that racism and trauma impact clinical care. And for us, whether or not it's students who are in training or faculty who have been clinicians for a good long time, we all need this training. And I'm asking folks to really make a time to attend this. There are no CEUs for this one, but there will be CEUs for the one on November 15th. So we've done our best to just get these started without having to rely on the fact that I know faculty want CEUs for their trainings. Well, we've got a bigger commitment here, faculty and staff and students, and so we will do our best to do the CEUs. But in the meantime, please take advantage of what it is that Dr. Dandridge brings to our community. It was dynamic. We enjoyed her last presentation, and we got some really good feedback. We did a short survey afterwards, and the feedback that people were able to provide really helped us to Dr. Dandridge asked that it be shared with her because she wants to use that and ways to think in terms of how to better be engaged in the set of topics that she wants to talk about with people in her own community. So thank you for that. Thank you for supporting this process around including Dr. Dandridge. And we're engaged now with the Office of Diversity and Inclusion. They will now be engaging with Dr. Dandridge as part of the ongoing teach-in. So we've been able to bring someone from our own community of acupuncture provider into a larger set of trainings for our larger college. And so I'm very pleased about that, and I appreciate the support that you all have brought to that. Another piece of information I want to share to you, and that is that we're in the process of implementing electronic health records. We have brought Jane App on board, and Ian and Alice in the clinic have been engaged in that training and the implementation of that for the last month. It's a big step. The clinic has been operating in a certain way for more than 20 years. Those systems are tried and true. They may be a little bit antiquated, but nonetheless, they've always gotten the job done, and things are changing. And with that change, it means that as we bring on electronic health records, it's really geared towards also opening up a whole level of training and preparation to move into telemedicine. And we've engaged with Dr. Jonathan Wheeler to sort of spearhead that project for us. And he has agreed today to bring us up to date on what that may mean and how we're going to be moving forward with telemedicine. So Dr. Wheeler, thank you so much.
You're welcome. Yeah, happy to be here. So all I can say is that we are, rolling out this pilot program for telehealth, and I'll have my students on my clinic shift, and we will meet with a patient on Zoom, and we'll conduct an intake and then have them wait while we do a diagnosis and develop a treatment plan. And we encourage all students to be patients. There won't be any charge for this, and we need bodies so that we can get this rolling. And it'll be Wednesday and Thursday for my shifts in the morning. So call Elon, make an appointment, and we'll get you in there and try out this telehealth medicine. The main thing is it's going to be everything but acupuncture. So we'll be prescribing herbs and dietary recommendations, everything that you can think of that's in our scope of practice that's not hands-on. So there's a lot we can do in the nutrition aspect and everything. So I think it'll be good. We just have to see how it actually works, and we're doing that next week.
Mm-hmm. Jonathan, can I ask a couple of questions about it? Just maybe clarifying. And that is, you mentioned that we'd be asking students to engage. And can you say a little bit more about, piloting it with some of the students who we have a file for already in the clinic, right, and how it is that if they become our piloted first patients, how we can take advantage of that process?
Well, then you'll get a chance to, as a student, you'll get a chance to see how it works from both sides, hopefully. Once this is up and running, you'll know what it's like to be a patient as well as being as a practitioner. We're going to just access the chart, the information that the patient gives us through Jane, and then we'll have a chance to look at the chart before we meet with the patient, and just take it from there. So, it's a great opportunity for you guys to learn what's going to be happening with our version of telehealth, telemedicine. You can see what it's like from both sides.
Mm-hmm. And, one of the things that we talked about was that we would be seeking direct feedback from students so that we can, because we felt like if we started with students who had already been patients, that we'd have insight into a larger set of training students, and then as other practitioners, supervisors are able to also just view the process, that we'd have a much larger, more expedited training for everybody involved there. And so Jonathan will very likely be reaching out to some of his students to see, and engaging them to see who may be willing to step up and help us in this first rounds of telehealth sessions. And we have a couple of questions. Let's see. Taylor says, will we have access to their old charts? Our goal with that is that as new patients come on, people will come in and implement their new information into Jane almost as a new patient, and then we'll be able to scan and upload some of their former treatment notes and soap notes as part of that chart. And then somebody else says, awesome, how do we sign up? Stay tuned. We'll be giving you more insight into that. Like I said, like Jonathan said, we'll start that on his shifts, and then we'll be moving it elsewhere. So we'll let you know. Thank you for your enthusiasm and for being a part of the process. Jonathan, you sent me a sort of a diagram of how that was going to work this morning. I was excited about that. I think you got a good plan in place.
Oh, good. Yeah, we talked about it on my shift yesterday, and we figured out some things, my students and I. So we got a little step-by-step process of how it's going to work. There's a couple of places where, like, what does the patient do while we're doing the diagnosis? And I guess Zoom has a little waiting room function that we can put them in while we're doing that. And then, there's a follow-up email that has to happen so that we can summarize the appointment and give that to the patient along with, the instructions and things like that. So those two areas, we have to work on and see how well that works. But I think, I think the first appointment, it'll take longer, and then we won't have to go over as much for the second and, continuing appointments. But that first one, we'll have to tell the patient, what to expect and how it's going to work, and, figure it out as we go.
Yeah. You know what I like about what the design that you're putting together, Jonathan, is it brings students in as part of the early on foundational assessment process.
Right, and then
I like that.
The telehealth model definitely gives us more time to do research as we're doing the intake before and during the diagnosis part. So, we can access the chart a half an hour before we actually meet the patient in Zoom, and do plenty of research there in terms of what the drugs they're taking or what the Western diagnosis might be. And then another opportunity while we're actually doing the treatment plan. One thing we kind of want to do is really present the patient with a formal treatment plan that includes, frequencies of meetings and duration and prognosis, and we can really make it clear what we expect from the patient, because of course it's going to end up being a lot on them. It's going to be a self-care model, more or less, because we won't be having them lie on the table and getting a treatment.
Yeah.
And so we're going to have to explain to them where points are if we want them to do acupuncture, acupressure, and self-stick moxa and qigong exercises. So all of those may have to be explained live on video, which would be great. But it could. I'm curious to see exactly how long this is going to take one treatment. Yeah, and somebody asked what my shifts are: Wednesday morning 8:30 to 12:30, and Thursday morning 8:30 to 12:30.
Dr. John, thank you for taking this on for us. We are grateful. I know you're having some fun with it. I know it's a good new thing, and it's also it's a completely different conversation than you all have been having with some of the ongoing patients for a long time. But it's a good conversation, and Chinese medicine is so much more than just acupuncture, and the whole health coaching concept, the ways of helping people to make behavioral changes and make those changes in a way that can be empowering for people to bring that knowledge that you can share into their homes and share with families. I think we have a new set of not just set of conversations, a new way of being with patients. And I'm excited to find out how, because I think that the students can really take off with this, and help us to understand how it is that we may want to ongoingly shape the telemedicine. Okay.
Anna was asking about the fall. We haven't gotten the clinic scheduled together for the fall, right?
Yeah, we're going to be moving into that here in just a few minutes. That's the next part of our meeting here. So I think we'll move on. Jonathan, people know how to reach you. I'm glad everybody knows that this is going on. It's been, we've been trying to refine it to a place where we can get it started, and Jonathan has really moved that forward. And I just want everybody to just really know how hard Ian has been working to shift this culture. It's massive. It's massive, and it's scary because once we go in this direction, we're not going back. There's not a safety net of returning. So it's taken a lot of courage and bravery. And so anybody who's in connection with Ian and Alice, gratitude there would be well placed. I just want everybody to know that. So thank you, Jonathan. I'm going to move ahead now with some other things that folks have brought up and are needing to know. And let's see. I want to talk to people and let folks know about what the preparations are for preparing to open up Arkansas campus for fall semester. It's tricky. it's tricky, and we are still in the process of making preparations to open up Arkansas campus. And Ian and myself and Michelle Lau and Alice Yu have been working closely with the Office of Facilities at CIIS to be able to prepare the campus. All safety measures are being put in place, meaning that we've, looking at how we're going to set up the classrooms downstairs. We will, at this point, we are not planning to use the clinic space upstairs. We are holding classes and clinic downstairs in the three classrooms and also in the community room, so that we can spread people out for safety factors, of course. But we have those classrooms already set up and with clinic and with treatment tables, so that we can have a variety of different processes take place downstairs. So at this point, what we're looking at doing is of course, that we have all the didactic courses that we can teach online. And then for the didactic courses that have a clinical component or a techniques component, those will be scheduled in modules, concentrated modules, generally on weekends, so that people can come spend 4 to 6 hours at the campus. I promise you it won't be 4 to 6 hours solidly. There'll be plenty of breaks and, leaving the classroom, but nonetheless, people will be able to do their point location, do CNT, do the work that brings people into clinical competency level face-to-face. And so that schedule, I know Richard has been working on that, and if that will be made available to you ongoingly so that you can make plans about it. Then I want to talk to you a bit about what's going to happen once you get to the campus, and that what we're going to do is that in relationship to the San Francisco Department of Health, the standards that the Council of Colleges of Chinese Medicine have put together specifically for Chinese medicine colleges, will be implementing and asking you to adhere to standards that have to do with, proper use of your personal protective equipment. We will be providing masks, we will be providing face shields, and all that it takes to make sure that everybody is in a safe, is operating from a safe place, including faculty. So that plan will be reaching you soon, probably as soon as next week. We want everybody to know that there'll be a training involved. Everyone will be having a training that instructs you on how to be in the space, what to anticipate, what the standards will be. Everybody will need to adhere to that and agree to adhere to that to actually be on site. So those infection controls that will be implemented and maintained, we'll all be maintaining those together. So it'll be a community agreement in order to be able to hold face-to-face classes and clinic at Arkansas campus. One of the questions I anticipate before I turn this over to Dr. Bing Zhou to talk about what's going to happen with clinic and with clinic lottery, and that is students continue to ask the right question. As usual, you're good students. Your questions have been, will we see patients? Will we hold clinic? That has been a difficult conversation. It's been a difficult conversation in relationship to the leadership at CIIS. I've continued to inform them and provide the standards that are out there for acupuncturists, as well as the standards and the guidelines that are being utilized in other colleges. And our plan at this point is that we are going to have a patio clinic upstairs. We're going to start by using some of the Acupuncture Without Borders guidelines and standards to be able to invite our patients back to receive treatment out on the patio. I've been in conversation with Carla Kessler. Many of you know Carla Kessler, of course, but she is going to be involved in some of the training for that, making sure that our faculty understand sort of the process around being able to have that type of community clinic. You know, there are processes and guidelines that Acupuncture Without Borders has developed that is totally appropriate for us to use not only on the patio, but they have tweaked their, I should say modified, their guidelines for Acupuncture Without Borders treatment in the time of COVID-19. So I feel quite confident that, you know, that what we can provide and get started on out on the patio is going to be safe for students and safe for faculty and safe for patients. There are specifics to that that are not going to be too simple. We are not going to be able to allow any of the patients into the building. We won't be providing toilet access for any of the patients. So I met with Alice and Ian yesterday, and we began to talk through how it is that how they are going to reach out to our existing patients to let them know, you know, what to anticipate. We started the narrative on that so that as Alice calls people, she'll know what to say and how to instruct people, and so that we have as full understanding as possible before people begin to come back. We're also looking at having people schedule in advance every 20 to 30 minutes to start with, so that we can manage people easily as they come on board for their treatment. So another question is going to come up: how frequently will the pop-up clinics be held? I don't have a schedule for that yet. Part of that will be in relationship to some of the clinic supervisors. How many days a week will it be? I don't know that yet. That will come out in the next probably week and a half to 2 weeks. But I just want you to know that it is in the planning. It's important that it's in the planning, because as Dr. Zhou is going to talk to you about, and that is that we have ACOM standards. Our accreditation commission still is requiring a certain number of face-to-face encounters, and some of that we'll be able to accomplish, I believe, through our pop-up clinic, the AWB-based clinic, and then as well as students treating students when they're on site at Arkansas campus. There's a lot to think about. We have a lot going on. We've got a lot of balls in the air, and somehow just keeping those balls inflated has been part of what our goal has been over the last weeks. But it is all under construction, and we are looking towards inviting you know, the reentry of the campus on the 27th of August, and starting fall with face-to-face component. Okay, I'm going to pause there, and I'm going to just, at this point, I'm going to make sure that we have time. I want to make sure that there's time for discussion around clinic that's coming up and clinic lottery. So Megan is going to go ahead and share her screen with the most up-to-date clinic lottery schedule that Bing sent us this morning. So thank you, Bing, and appreciate your conversation with everyone.
Hi, thank you, everyone. And those the clinic schedule has been working so hard that like the data survey data and all the data to trying to anticipate how many people could be online or could be on that person. So could we move into the next one? How about the last one, please, Megan? Next one. So this one's in here. No, the following one. Thank you. As everybody already know, and that's since the May 18, and those are the ACOM standard have been set up for the virtual training. And so those information have been sent to you since May and since June, since July, and also a few days ago we sent it again about the clinic lottery day. And those are the guideline we had to follow. And so according to our calculation, some of the student could be on the virtual, and some of the student, and some of them student maybe one shift on the virtual, and rest of them should be in the in face-to-face. So those the hours of the virtual hour understanding is including everything the virtual hours, and make up spring shift hour for the virtual and regular summer clinic shift hour, and also the regular shift fall clinic hour. So all the things here from the Wave that approved by the ACOM, that's 250 hours for the intern and trainee, that is the levels in here. And if you are observer, you had a 75-hour observation, if you move from observer to trainee level, actually you will be jumping to another level. So for you, if you had finished 60-hour observation, the fall semester, you are in the clinic shift for the intern level. I'm sorry, on training level, actually you will be, clock will start again for 250. So for you, for that small group people, it's okay for the high little more hour, but most of people is not in these cases. For example, like it does, if you are an observer in the this semester, it's 60 hour. In the fall, when you move into the another observation observer lab, the shift you cannot be able to move into virtual. So that's the data and the analyzing. We give you, we asking your survey, and also according to Richard's data, according to John's data, according to faculty data, send it to me, and then come up. Can we move back the second page, please? That's come up that solution like the estimated, and how many person to person, and how many virtual clinic shift. So for the intern, we anticipated maybe we needed to about 66 or 67 students needed face-to-face, and about 33% the people could be doing the virtual. And that's the best estimate what we have. And since the training level, we had more hour to can finish that. So in the training observer, and actually we had 60% is a virtual, and 40% in the face-to-face. So on the screen, you can see Monday to Friday. And we have the intern level to face-to-face is about 8 shift out of 12 shift. And we had a 4 virtual out of 12 shift, and for the intern level. So intern 1, 2, 3, 4, we don't separate the 4 out of 1, 2, 3 anymore. So the intern 4 level is you can pick up any intern level is for fun, it's okay, according to the student feedback or the faculty feedback. And so that for 4th semester, intern 4 is not separate anymore. And also every shift, and since the clinic going around more than for the fall, so every shift is a 1 faculty and 6 student ratio, including the intern and including the trainee observer level. So doesn't matter virtual, doesn't matter face-to-face, and 1 shift and 1 faculty and 6 students. That's what we can, I can answer to you. Oh, one more thing's changed since John sent to you a couple days ago. And on Wednesday afternoon, so many people taking classes intern. So so we move in that 1 shift to Friday morning. And that the Friday, there's nobody, we don't have static courses, because when we put it in a Wednesday, only intern 1 student could take in that clinic shift, and we didn't think it's viable for that shift. So we move in that Aaron's Wednesday afternoon internship and move into the Friday morning shift. So that decision has been made this morning. And so that is I think what can I say, and if John, you had any more to say, we more, but that's what summarizing what we're happening. And like Carla mentioned, when we can see the patient right away in the patio, I think the first one, at least first week, would not maybe my recommendation, depend on faculty. For me, for example, in the Monday afternoon, I do have a face-to-face clinic shift, and for me, maybe I use in the first week, I want to have some see introduction and see what's going on in here, because we haven't seen patient for a long time. So maybe first week we should be happy with the slower down a little bit, at least my shift as a faculty member. And then we will come up some patio treatment, but at least we, during that time, during the face-to-face time, I know it's required by ACOM, the situation, but also we do have, even though without a patient in the first week, we still have a lot to do. Like we can practice the technique each other and treated the student each other. So we had a lot more hands-on when in face-to-face.
Mm-hmm.
I will stop here. And any question? And also the schedules in here, next Monday is intern level lottery, Tuesday is training level lottery, and Wednesday is observer lottery. And during lottery time, we maybe need to shift around the virtual and then the face-to-face according to your calculation. And but we should need a more flexible situations in here, because that's the best we can estimate it, and what's the percentage in the virtual versus the face-to-face. But we may be needed to flexible move around after or during lottery time or after lottery time.
Mm-hmm.
Needed to your careful calculation, and from we send it out to the memo to you regarding to the 250 hour for intern and trainee requirement. You cannot over it, and otherwise we can more challenging for you for the graduation day, and or more challenging for you for your moving processing, and 70 hour for observation hour for virtual.
Mm-hmm.
John, you have any more to say, or any from the student or faculty, any questions?
In my case, I just analyzing every students how many virtual they spend the time. I have their register, how many clinic shift I using that. I really recommended it. Students, when they coming to the lottery time, please check how many hours do you using the virtual hours. But I provide whole data from your register in spring and summer. I have that too, and then I'm guiding you. But sometimes you extra is missing, and that kind of things. You make up more. I don't know that, and therefore maybe you can provide that information. It's much better. But I have everything, and then we try to making possible smooth lottery, and therefore don't panic. We have to enjoying for a moment. That is I want to talk to you. Okay, thank you.
Okay, so I think two questions in here from Tara and Emma regarding question. If you not mess up the virtual hour, can I do the face-to-face? Of course, yes, because that's what we understanding. Some people didn't register in the summer semester because you want to face-to-face and the clinic education. Yes, if you has not messed up the virtual clinic hour, you still want to in a face-to-face here. Yes, you are able to assign up a face-to-face, because that's a choice. And but we do have an option for you if you don't want it to face-to-face. If it has not messed up the virtual hour yet, you could be able to virtual. But if you already mess up your virtual hour, it's not recommended to take any further virtual. Otherwise, those clinical the hour maybe not credit for that. But if you want the person, even though you has not do any virtual yet, you want to become the person observer, or you want to person to trainee, yes, you can do the face-to-face clinic shift.
Can I comment on that, Bing? And that is that I want to remind folks that we really don't know where the pandemic is headed. If we don't see it, we don't see any end in sight. And so it may be that some people want to think about taking advantage of face-to-face clinics now. I'm not advising that. I'm simply raising that because I feel like it should be raised in this meeting for folks to take that into consideration.
Bing, are you going to cover the draw order, or are we going to go over that at the beginning of lottery on Monday?
At the beginning of lottery will be easier. don't go over here. I think the town hall is to spend too much time.
Okay, all right. Thank you.
Yeah, thank you. And yes, if you sign up the virtual clinicianship, that will whole semester is virtual. If you sign up face-to-face clinicianship, your whole semester will be face-to-face. Depending on, like Carla mentioned, depending on the COVID-19 and pandemic situation. And if we have, the always evolving, if we have a situation getting worse situation, we may be moving back to the virtual. And those things, yes, but open to our schedule here. If you sign up virtual, we'll be whole semester virtual. If you sign up of the whole face-to-face, it will whole semester face-to-face. That's our plan to go forward. And if we, if the face-to-face shift is if more, you fill up, like I say, we maybe just needed to open, if more require face-to-face, maybe we should open the face-to-face. That's what we had to be. Those things here it's our the estimating. And cannot force the people, you had to be virtual or you had to be face-to-face. And so those things here, you had to make a decision by your own, what's the best education level you needed to face. But we're trying to support you in here. If we needed to move around, we will. And during the lottery time or after lottery time, and we were working with you, we were working with the faculty, and then try to do our best to support you. What's your best education, the experience you want to get?
Mm-hmm. I want to add something, and that is, I feel like I've been remiss not to mention access to the herbal dispensary. And even though we will not be holding, using as we move back into the campus, we are not going to be occupying as faculty in relationship to students the first floor, the clinic. We are going to make sure that the clinic is open to the minimal number of safe people adhering to distance and safety, so that the herbal pharmacy can be used, formulas can be made. If people who come for the patio clinic want herbs, if you want to recommend herbs, that we can certainly provide those. We should also be able to provide herbs through the telemedicine. We have a plan in place where people can pay for those either online or over the phone, and people can drive up in their cars and we can just give the juice. I just want to make sure that folks also know that that clinic is also inclusion of the herbal pharmacy. And I think there's some other questions there, Bing.
Yeah.
Okay.
So Matt's question I got to answer. That's good. Matt's question, are you still? Yeah, we're still trying to working with ACOM, but so far the situation that has not been changed.
I can speak to that just quickly. Excuse me for interrupting, B. And that is that I had a conference with ACOM executive director a week ago. They at this point are not seeing any changes. It's not that they wouldn't if they could, but they have to adhere to whatever's going on with the Department of Education. And however, I'm in conversation and have helped create a letter to our Council of Colleges, and we are taking a proactive approach as the community of Chinese medicine colleges in the U.S. to create a plan to expand that, to see if they can at least provide a temporary waiver to expand those hours based on the continued pandemic. So as we know anything, we will be bringing that to you and sharing that with you. But for right now, what Dr. Bing showed you earlier on this slide, that's what we're working with. And we'll just keep working with it until there's any sort of change possible. And I hope there will be, but in the meantime, that's why we have a plan here for you and want you to think in terms of it, maximizing any face-to-face that you feel like your lives can accommodate. Thank you.
Thank you, Carla. Yeah, the Terrence question, yes, if you the 60 hour in the virtual, if you partial, I'm not recommending you taking another virtual in the fall. So I recommend you taking in the face-to-face. And Helena's question, yes, and we are even the intern level, even intern 4 level right now. Unfortunately, COVID-19 situation, we are not treated the patient one-on-one. We are treated as a group treating patient. That's the best we can plan for it. Any other questions?
There's a couple more questions coming up here. Let's see. Bing, can you speak to the question about offering extra makeup shifts as a possibility?
What do you mean?
Aaron Riley has
makeup
raised a
shift.
question. Given that COVID is increasing in the SF Bay, perhaps we can consider offering extra in-person makeup shifts earlier in the semester. There is also concern about cold and flu season may look like in December.
I cannot answer. I think the question is for you. Sure. If you make a decision moving forward due to the financial impact situation, we could do that. We could work with the faculty and to do that. But that's maybe we can discuss it in the program committee.
Yeah, it's a bigger discussion for us, but it's the right discussion. It's the right discussion. Yes.
Yeah.
Okay. I want to speak a little bit to let folks know that we're anticipating a change in student packets. We're looking at putting those packets either in Canvas or in another format so that you'll be keeping those up to date online and no longer having the packet as we used to know it as a series of stapled as it used to be. So I've been working with Ben Suzuki Klein on that, just trying to think in terms of a way that you all can keep those up to date. Joan can help you manage those, and then Bill, you can just submit those. They will be submitted online and make the process a lot simpler for everyone. So we'll be bringing forward information for you relatively soon. It should be pretty easy. It'll just be, recording who you've seen and typing it in and bringing your record up to date ongoingly. Okay. We have a few more minutes left, and I know that folks are going to need to get back to class. So if there's no other questions, there's a few things I want to acknowledge, and that is I want to remind you all that there are people who are working behind the scenes really hard and managing a lot of information to support all of you all. And one of those is Dr. Andrea Nada, who is working with all of you on your programs of study and helping you to make decisions and just really got your back. Dr. Nada's there, and I know that you all know that, but I just want to acknowledge and thank her for all that she does for everybody, helping so many people to make decisions that are really going to impact how they're going to manage the duration of their study. So that person deserves a hand and a thank you. Thank you, Dr. Nada. The other person I want to acknowledge and thank is Richard Alberta. Richard Alberta is the person who just maintains so much information, looking at and planning ahead for each semester, managing the schedules for both faculty and looking at who's moving forward with their program of study, working closely with Andrea on that. And Richard, I just want to thank you again. I want people to know how much the work that you are doing means to each and every one of us every single day. And Richard is here recording this so that he can make sure that we have a record and minutes and notes from this meeting as well. But Richard Alberta, thank you for all that you have brought every single day to what we do. And Richard is part of the program committee, keeps the minutes, and just really helps all of us to keep on task. Thank you, Richard. Next, I want to thank Megan Shea, who has stepped up as our program manager, and I absolutely do mean stepped up and out, and she's doing a marvelous job on so many levels, from managing all of our info sessions, open houses, which we have one of those tomorrow. She's also headed up in providing the leadership for the pinning ceremony for our graduates from the last semesters. And so Megan has brought a lot of skills, a big open heart, a great a great mind, but she's also been the person who's really shepherded forward our work with Dr. Tanisha Dandridge. And Megan, your skills, your many skills, and she's an artist. She can't help herself. She brings art and style and creativity to all that she provides for us at ACTCM. So Megan, thank you. And I also want to give a big shout out to Michelle Lau. If there's one person amongst us in our administrative staff here that really provides the connectivity, the connective tissue, and holds the history and literally knows where everything is at our campus, not just on campus, but also sort of who knows what and how to find it online to best support the students. Michelle Lau is that person. And she is the person who is making sure that our garden is going to be tended and welcoming us back. Michelle is the person who's maintaining our plants inside and out, and she's been working closely with Ian and Alice to prepare our building for our return. And so Michelle Lau, thank you. Well done. Thank you to all of you all. And even though, we come together every day and there's classes that get rolled out, and, there are unsung heroes who are making all this work for all of us. Sometimes we just forget, I think, to acknowledge the fact that remarkable work is going on. If we had planned for this, we could have planned for 2 years. And I don't think it would have been going a whole lot better than it is just right now. There's a lot of people who have stretched exponentially and learned things on the fly. And, there are faculty, some of your faculty and clinical supervisors have had to step forward and rethink their whole delivery of classes that they may have been teaching for 20 years. It's been a lot of stretch. But as we know in Chinese medicine, as we talked about a little bit earlier, and that is, change is about life, and life is about change. And so we have all been invited to live life differently and to embrace those changes in ways that sometimes just feels downright crappy and really uncomfortable, and we're unbalanced. But every day is a new day, and I see people showing up and doing that in a marvelous way. And I see that with our faculty and our staff. I know what's going on with you students. I don't see that as deeply, know that as deeply with you students unless you reach out to me, but I have faith that it is. And again, I want everybody to just do everything you can to take care of yourselves in each and every way. Take time for yourselves. Let us know if there's more that you need from us. And as I said earlier, please don't stop letting us know what's going on, what you feel like we need to know. We are here because we are committed to you. We are Chinese medicine. You are Chinese medicine. We are here in this together. And we all just are doing our best, and I have faith in that every day. So if there's more that we need to do to support each other, students, keep letting us know. Reach out to us. There's nothing here that can't be discussed. I just want you to know that. You don't have to spell check your emails to me. Just get it out there and let me know. Okay. So with that, I know that there are questions in here that we could spend more time on, but our time together has come to an end. Of classes starting. We all have places to go and things to do, and lives to lead. So I want to thank everybody who showed up today to be in support of our college and of each other. You are precious people, and students, you are the future of Chinese medicine in this country. I bow to you, deep bows to you for choosing that and staying steady with it. And leadership, core staff, and faculty at ACTCM, my colleagues, I'll be forever indebted to you for the commitment and heart that you've brought to our college at this time, a time of struggle, and for just continuing the work that we have all signed on to do. Cheers to the process of change and reconfiguration. Well said, Brett Ray. Well said. Everybody, please take care, and I will look forward to more later, and see you later. Bye. I'm sending you chi. Chi to you. Bye, everybody.
For the people who don't want to leave. Hi. This is for the people who don't want to leave. You can just end it, I think.
Yeah, I'm gonna end it. Hi, Michelle.
Bye.
Bye. See you at 3:30.